Excited. What'd you say?
Let's show them. We're here.
Park.
We're at Central Park.
Beautiful today. We're at 30 Central Park South, you guys, at my friend's office that we are here at every 2 months. And we are doing one of our younger patients a resurfacing treatment today. But you guys know this is acne scar combination. Not only are we going to improve his scars, we're just going to keep him looking young. We're going to keep him looking really good by doing a combination of things. We've already done TCA cross. You know, you can see in these ice pick scars, take a look, show them, Jordan, really quickly. Ice pick scars, all the frosting. That's the TCA that we have done on the ice pick scars. So that's our deep treatment there for the deeper ice pick scars. That's going to be acid that's going to peel. It's going to fill in those spots. Then we did some filler to fill out the scars. He may not even need that again. That's the Bellafill. Of why you got to do Bellafill in a lot of cases to enhance the results of lasers for scars. But now we're on our third part, our deeper microneedling radiofrequency. We know this as skin tightening, but we're focusing today a little more superficially. That's why you can see a lot of bleeding, to puncture the skin and get the skin ready for laser treatment. This is going to enhance his laser results and give him an optimized, enhanced outcome. All right, you can put numbing on the forehead. An optimized, enhanced outcome. We're using PIXEL8, you guys. This is our deep microneedling radiofrequency, one of the newest ones on the block. Really good and aggressive treatment. You can hear it really puncturing into the skin, which is why I like this for scarring, and I like it for deep skin tightening. I'm gonna go into the cheek area now. Once we do the PIXEL8, we add a little more numbing. Remember, the little channels that are open will allow the numbing to go into the skin a little better. And now we're working on the scarring areas. He really has actually really nice skin, but he has a few problem areas with ice pick scars. Those are going to be the hardest to treat. They're going to take us a few treatment. Jordan, I don't know if you could show the ice pick results that we posted on stories.
Right now.
Oh, that would have been great. So tell them where to go to see the
guys,
recent.
if you want to see those results, guys, go to our stories. Guys, we posted it at the end of the night last night. It's on our feed. We have some surprises coming for you with acne results. Guys, we have a lot of great people sending their stuff in right now. We can't wait to show you.
And the one thing to understand, you guys.
Someone wants to know what laser for melasma, Dr. Emer.
You know what? You gotta see me, because a lot of times lasers for melasma aren't the best choice. Pico laser combined with clear and brilliant is probably the standard for melasma, except we do all of our at-home peels and we do our derma rolling protocol with my Aerify roller. My Aerify roller has actually an amazing ampule in there made by myself and Antiage. It's stem cells and it has two peptides in there, one called DDPD that actually breaks apart pigment. It almost acts as mesotherapy. It would be very useful for someone to do that. Also, we just added from Nude Skin, guys, you know that product, that company that I help make our skincare products for, a Titan Bright face mask, which is mandelic acid. You could literally do it 2 to 3 times a week. Really helps melasma. There's other products like Cispera and Cosmelon 2 and Enlighten Peels and stuff. So I would definitely go to Emerage Cosmetics and make a virtual consultation. We can literally just send you the skincare and prescribe you a medication called tranexamic acid.
Someone's asking, I need that. I'm suffering with my face's skin, guys. Come see us. Send us a DM. Full name, email, phone number. We're happy to reach out to you.
He's doing really, really well for a deep treatment that typically has a lot of pain.
Can we ask him how he feels?
Yeah, of course. I mean, sure, he's gonna have a little bit more pain than girls do. Guys tend to be a little bit more sensitive. How does it feel?
Honestly, it's fine. The pain level's really low.
Okay.
Or really relaxed.
That's really good.
Yeah, if you just let go and trust in
I think that's
their
what you gotta do.
That's fine.
Honestly, I feel like that's usually what you gotta do, you guys, because if you don't, it tends to, your brain tends to be more nervous and sends more pain sensitive receptors. So you guys gotta relax and trust and meditate a little bit.
People are saying, thanks Doc, love your work, and I love you guys.
We love you guys too.
Thank you guys for tuning in and supporting us.
And you know what? This isn't about me. This is about the reality and the patients. I want people to make educated decisions about who they go to and what they do. let's say you're far away, although my patient here is far. Where are you from again?
Originally Little Rock, but
Oh.
I've been in the city for 6 months.
Oh, nice. Okay, yeah, Little Rock. So coming from far, you guys, sometimes you need to go to an expert for certain things. And this treatment, for example, it only needs every couple months. So sometimes it might be worth it. I'm gonna have you turn all the way
The
left
patient
now.
that we saw yesterday, guys, she had some acne scars. She went somewhere else, and they actually made them a little bit worse for her. They made the edges more raised. It was very hard to treat it, but she is looking significantly better after her treatment.
It's on our Instagram. It was very hard to treat. But I do want you guys to know that nobody's perfect, and sometimes the skin responds differently. In some people, it gets more of a result, and in some people, it's less. But you always get a result over time. The other thing is, some of the patients, if you do a stronger treatment, you could be red up to 6 months for some of these treatments. And the redness is normal, actually. In some people, it's just a response to your skin. We call it post-inflammatory erythema. And that can go away with peels and skincare and proper sun protection. So just know that when you do lasers, it's not always going to be perfect, but it's manageable. Everything is manageable.
They're asking what cream is she putting on the skin, guys. That is our numbing cream. We're going to do our CO2 laser next, guys. The PIXEL8 did create some nice channels right now, but the numbing cream penetrates the skin much better. We want our patients to be comfortable with these deep treatments.
Under my nose.
Oh, I'm going to get all those, don't worry. Yeah, I'm going to laser there too.
Thank you.
I'll get it, don't worry.
We
So,
love showing you these treatments live. We have a lot of viewers on right now. We love showing you the reality of the treatment, what happens during treatment too.
and what's important is that you cover every area nice and slow. It's really important. Yeah, we get
enjoy their Saturday morning on
everything.
here with you.
What?
A lot of people spend their Saturday morning with us.
Coffees and CO2s. What was that Saturday Night Live with those two funny Jewish women? Remember? It was what was that called? Oh my god.
It was Amy Poehler.
Yeah.
And,
What was the
Rudolph.
skit though? What was the
can't
skit?
remember their name.
That was so funny. They used to do like they would sit on the couch.
Like Jersey wear.
Yeah, and they would talk like about like with coffee and like to make these funny jokes.
Right now we're using this more for tightening and retexturing our patient's acne scars.
Exactly. So I'm working a little more superficially than I do. That's why you guys can see I'm doing a gliding technique right now. This is going to puncture more intensely on the surface. This is different than my stamping technique that you guys saw before. This is gliding, and this is going to give him a little bit more an aggressive. Look at that. I'm gonna stay on. Okay. We're gonna go a little closer to the eye, but we're gonna do plasma pen here, so we don't need to go all the way up to the eye. And then we're gonna do a little on the nose pores because he's got nose.
Guys, if you guys like this, you guys are gonna want to stay on to see our CO2, which is gonna be our ablative laser we're gonna use to resurface his skin.
And he's doing really well. Boys tend to have a little bit more difficulty with pain than the girls do. Typically because their skin's a little thicker or they don't have kids or periods. That's my opinion. So, all right, so we did it
Someone said,
really
I had this
even.
combo done. It was red for almost a month.
Yes, that's true. That can be,
They
and
had
that's
the combo.
normal.
They know.
They might
They need
be.
to come back soon for another session. They're very happy. They said results
Turn a
were
little
tremendous.
And see, that's the thing. You just have to be okay with the process. And if you do an enlightened peel at 2 or 3 weeks, it helps to speed up that healing. Using Dermabeam Pro, which is a facial mask, will make the redness go away more quickly. Some people, it's just their own skin, and the redness means collagen production, you guys. So don't be upset at the redness. You just have to
Trust the process.
trust it and then use sunscreen that's tinted, like my Fusion SPF, to cover it up.
Someone's asking your depth.
Can't give that away,
Can't give out
guys.
information. If you guys can read the dial, you can read the dial, but
Okay,
we're not
we
that
put
close.
numbing on there. So now we're gonna put a
So
little.
it's how much for this treatment, guys? Here's the DM, full name, email, and phone number. The amount of treatment and areas we do is customized to each person's acne scars. We do multi-step treatments, guys. Before this, we did do some Bellafill. We did our TCA. It just depends on the patient.
Dr. Emer,
Yeah.
I don't know if it mattered to you.
Sorry.
I had a rhinoplasty about 3 months ago.
That's okay.
If
You can
you
still
wanna-
go over.
If you wanted to mention that, because I think a lot of people might be hesitant
Yeah.
to get something.
Oh yeah, I
soon.
think it's a good idea actually, because I don't know if people know a lot about me. I started in ENT facial plastics, so I'll explain. So yeah,
we have a lot of people on. Should we just jump into CO2?
Yeah, we'll jump into CO2. We're gonna get that ready now. One of our processes. We're renumbing right now. We're cleaning. So what he was saying was he had a rhinoplasty. It looked great, done a few months ago, and people are very nervous when they get a rhinoplasty to get laser. The laser actually will help the surface of the skin when the skin is redraped on during a rhinoplasty. Often you can get what are called porous plugs. You can get like acne and plugs that develop in the nose. It's very safe to do. Remember, this is only on the surface.
People want to
so
know
it's not,
where we from, guys. We are based in West Hollywood, California, guys. We do go to New York, we go to Boca Raton, and maybe some other places soon. Dr. Emer's getting his CO2 ready, so hang on. Bruh, he's literally bleeding. Yes, guys, he is.
Okay, need my goggles.
Let's get the B goggles and we'll start going.
Careful, okay? Might hit your
There
head.
we go.
This is what happens during entertainment. So, all right, what we're gonna do first is test. We're gonna do one thing first. I'm gonna do spot treatment first over a couple small areas. So, turn a little bit here. I'm gonna go to a couple of these ice picks. Good.
There's absolutely no pain. It's just the same. It actually everything feels really
Oh, yeah.
soothing.
Everything's gonna be good.
Alright,
Lift
try
your
not
head
to
for
open
me.
your eyes. You have the numbing cream.
Someone
Lift your
wants,
head.
someone wants to talk to our patient. They said, please thank the patient for allowing us to view this procedure.
He says thank you. Do you want to say thank you?
They're thanking you for allowing us to
Thanking
film
you.
it.
Oh yeah, absolutely. You're welcome.
So I'm spot treating. Turn a little bit here. Some of the TCA spots.
The patients that allow us to film them, guys, it helps educate everyone on the process. The
I'm
treatment
finding,
is
so
done.
there's little spots here or there that I want to do independently. Good. Get a little mole here that's probably developing, so I'm going to shave that down. Good.
Someone saying he's going to have amazing results. He is. We're very excited to show you his healing process too. Dr. Emer, do you want to talk to him a little bit about what his healing process is with skincare?
Yeah, you guys, it's really important. He didn't really need to prep because, let me turn here, I'm just going to do a spot on your nose. Hold on. Good. He didn't really need to prep because he's very light skin tone, so it's just skincare. But post-treatment is going to be really important with our peptides and stem cells. Okay, good. So now we're going to do full. I'm going to start the full area resurfacing. Hold on, and I'll talk to you about.
Someone
Okay.
said, I want
There
fully
we go.
ablative treatment, Dr. Emer.
Well, that's
we
what
offer that.
we're doing that right here. Sorry, I'm going to start right now, okay?
Yeah, you're good.
Be still. Here we
Yeah,
go.
like I said to GM, full name, email, phone number, we'd love to reach out to you.
So he's doing great. This is a little more painful. This is closer to full resurfacing because he's very light skin toned. We're gonna do full, or very close to full. It's about 90%, 85% fractional. So that I can really give him. You also saw that I spot treated. So what's gonna be really important is the stem cell therapies and our growth factors and our peptides. So MRI and refit face, anti-age serum combined enhances results and actually speed up this healing process because it's a retinol-based peel. It causes cell turnover.
We
Turn
have
the
people
head to the
talking
left.
about where they're from in the world. We have people all over the world on
Yes,
now,
please
actually.
tell me where you're from. I will love to comment on that. Bring that a little closer.
We have Philippines, we have Middle East, we have some people staying there from India on here.
I love that, you guys. And then what's really important is exfoliating. So he's going to use exfoliating enzymes, like our Jan Marini Skinzyme and my enzyme polish. He's going to do a lot of hydration. There's a lot of things that we recommend in our post-care. There's an ablative peel healing kit that's in our, if you can't get to me, it's at emeragecosmetics.com. But we can literally do a virtual skincare consult for you and send you whatever
People
you
from
need.
Tennessee, we have London.
Love it, you guys. Keep telling me where you're from and keep following and sharing. I really am excited for him because he's going to get a really awesome result, but it's also going to be anti-aging. And our next treatment, depending on how he does, we're going to continue TCA. But we definitely want to do, he's actually a really great non-ablative laser candidate long-term. We're starting around your eye a little bit.
Does it not hurt?
No, it does. Look, he's reacting. But
It's not that bad. It's really more the sound.
Is it the sound?
Uh-huh.
I mean,
For me.
yeah, I mean, I've done this, and I don't think it's terrible either, but it's not zero, you know? So he's doing really well. We're going to start now in the middle. You're going to feel a little bit here. The middle part's harder to numb.
People are asking, what the F is going on, guys? We're doing an acne scar combination treatment right now. We're on our final stages. We're doing our CO2 laser resurfacing. Right before this, we did our PIXEL microneedling with radiofrequency. Before that, we did some Bellafill to help add volume to the scars. And we did some TCA to help soften the edges of them, these deeper ice pick scars.
And in some of the areas, he's more numb than others.
Nice work, guys. You have that's Grady's on here. That's all center.
Oh, Grady. Thank you. Share and tag. So no, this is a really good. I'm very excited for him to get a really nice outcome. A lot of times you'll have like a little bit of a pattern on after a very aggressive CO2 for you know, even like a few weeks to a month. That'll go away with the right type of peels and skincare and time. Just have a little patience, especially with strong ablative lasers. In the time that we're living now, everyone wants no downtime. When I first started in the old days, healing chopped at 6 months. Do not do it. Lanolin and aggressive occlusives are not good for the skin. They are not. And anyone that's not inexperienced, they won't know. They're not trained properly.
So let's say, what is that, guys? Our CO2
amazing.
laser, guys. We have a lot of new people join us that don't follow us. Thank you for coming on and following us, guys. We're doing a laser resurfacing. We're treating our patients' acne scars.
Let me turn your head all the way to the right. There you go. Now the last part's going to be the cherry on top, which is the plasma pen.
Is this treatment for pimples on the skin?
No, pimples need acne
behind.
treatment. So tell them how to make a consult with Nisha, our PA, or with our team.
Guys, any treatment questions, consult, you're curious about treatment, guys, you can get you a consult with Dr. Emer, our lovely coordinators, our PA, or our skincare specialist. Send us a DM, email, phone number. We're happy to reach out to you and get you in contact with the right people.
So we're going to wipe off now the one sheet. We're going to keep moving. So stay still. You're doing great. This helps make it more manageable. So we're now going to start in the cheek in the middle. Okay, so don't move, okay? The best you can. I know it's tough. It's okay, rest with that. There you go. Get in that area on the nose you don't like. I want to tell you guys something.
OMG, I have lots of craters in my face. It's been years because of teenage acne. I need help.
Tell them what to do.
Guys, send us a DM, full name, email, phone number, or go to emeragecosmetics.com. Get a consult there. We'd love to help you and improve your skin.
We do need to make Jordan that shirt.
Yeah.
You guys, I want to tell you, when I started this 15 years ago, I did this because I was very interested in lasers. This was new in the field. No one was doing this. And also, I had a younger girl that had this birthmark all the way down her arm that everyone said couldn't be treated. It was called ILVEN. You can look it up. Inflammatory linear erythematous verrucous nevus. It's very difficult to treat, almost impossible. I was the first doctor ever to use this laser specifically to permanently get rid of it. It was all the way down her entire arm from her head. And after that, I was like, we can change people's lives with lasers if done properly. So then we got into it, and look at where we are now. We have patients flying from all over the world and talking to us from all over the world to get treatment. We're very excited about it.
I love to spend our Saturday morning with you guys.
We love spending Saturday morning coffee with you. And I'm just excited because I love seeing results.
Does he just go home after this, Dr. Emer?
Yeah, we have, in our office in LA, we have an aftercare protocol Luckily, he's very light skin tone, so it's going to be easier for him. Sorry.
Is this halo laser or CO2, guys? This is our CO2.
Almost done on this cheek.
This is
You're
not our
halfway.
halo laser. We do love our halo and use it
Turn
a
a little
lot.
more to the right. I'm going to
This
tilt your head.
patient,
Yep,
we're doing
perfect.
the
Just like that.
CO2.
Stay that 90 degree, okay? This is a very aggressive active FX. You guys have seen it differently before. I'm using a different technique here with him. So, perfect. He's doing really good. It's almost done on this side, and then we're basically there.
So we're getting there.
Very close.
Right now, let's see. Keep the questions coming, guys. We love talking to you. Everyone's sending their flags from where they're from.
I love that. Can you identify them all?
I can't identify them all, but I see them coming in.
Tell us rather than flag us. All right, hold on. Turn a little bit more again. I know it's hard. We're getting close. This is the harder part, okay? Because this part, there's no nerves. So it's just all topical, so you do your best. We're so close. So after this side, we'll finish and we'll pause.
What kind of treatment are we doing? They're asking us again. Guys, we're doing an acne scar combination treatment right now. Our patient has an acne scars on his face for years. He's been wanting to treat them. So we got him a nice customized plan. And guys, we're at the last stages of our treatment, which is going to be our CO2 laser. This is one of the more spicy areas, as Nisha the PA would say.
Yes, because there's no main nerves here. So it's only relying on topical, and I go all the way up, obviously, into the hairline.
That's
I know,
skin resurfacing.
We're almost there, two
yes,
more.
guys, we're at skin resurfacing.
Okay, so that's the sides all done. I'm just double checking. Make sure everything's filled in. I'm gonna do all the areas up to the plasma pen. Good. And I'm gonna do a little bit on the nose, so stay still.
Okay, what's the film that we see on his face, guys? These are all the spots from the resurfacing.
And the numbing.
And the numbing, guys. So you guys seeing what the cream was earlier, that was the numbing cream. What is that tube doing, guys? This is our suction right now. You guys see all the smoke coming off, all the dead skin cells right now. It's getting sucked up into the tube. So that way we are not breathing all that in.
Okay, I'm gonna turn you to the other side now.
Can halo laser offer the same results, Dr. Emer?
Similar, but not the same. This is more of a stronger resurfacing. CO2 is the strongest, so it's not the same as a halo. It would be good for him to do halo next.
Hello, where is this, guys? We're in New York City right now, but we are also in Los Angeles.
We're good.
Are you ready?
Yeah.
Here we go.
We're also
break
in
if needed,
New York City,
the hard
West
part
Hollywood,
first.
California.
so I can just get you through it.
Thank you.
No problem. You're almost done. This is the last part.
Someone said I've tried to have this done multiple times. Every time I try to see someone, they say they don't treat darker skin types.
Well, we do for sure. I don't know about CO2 though. You have to be seen to know if you can use CO2.
We have treatments for you that can help your acne scars. We'd love to help you.
We did a very dark skinned Indian patient yesterday with profractional and halo. So we need to see you so we don't know.
How long until he heals?
About a week. He's going to be, again, probably pink for a few more weeks.
If you guys are curious to see how he heals and how he's doing, guys, he's going to send us some selfies and keep us updated on how he feels
Yeah,
and
I
how
would
he
love
looks.
to get testimonials, actually, and watch him. His skincare and everything, too. Hold on, try not to move. Try not to move. I know it's hard. Deep breath, deep breath. The way this scans, we don't want you to move too much because it moves the laser beam. So I know, concentrate the best you can.
What are you doing and what is it good for, guys? We're doing a laser resurfacing right now. We are treating our patient's acne scars.
I'm going to do it above your lip because it'll be less painful while you're resting.
Someone says, if I book a halo laser, how can I change it to CO2 if I need aggressive treatments?
Call your coordinator.
Call your coordinator, guys. If you're with if you're seeing us, guys, contact your coordinator. Let them know that you want something more aggressive, and we can get you there.
All right, I'm going to go back to the hard area again. So I think that's good, Jordan. Let's end here.
Alright.
And then we're gonna do plasma pen next. So let them know what we're gonna do. We'll see you guys in the next step.
We're going to be tagging our patient's eyelids in a non-surgical way to get rid of fine lines, wrinkles,
Take a
eye
breath.
bags.
I'm gonna go back to the cheek, so hopefully you won't feel it as much here.
Alright guys, thank you for tuning in.
Bye guys.